All right, welcome on in here. We are talking men's health this morning. The 5 health checks men should be getting.
And joining us live is Dr. Greg Jones, who's the men's health and regenerative medicine specialist. Good to see you. Thank you for being here, Doctor. I appreciate it. We talk a lot about women's health on this show and all around. What is it about guys and why we don't go to the doctor? What's going on?
Well, I think one of the main reasons we're kind of taught as young, as boys, like, hey, if it's not hurting, you keep going, right? And so we have this mindset of we don't go to the doctor unless we really have to. We're in more of a corrective mindset versus a preventative mindset, right? And that's what we want to shift, right? It's like getting ahead of it, finding out if there's something going on in advance will help you out in the future. I think the second thing, there's a fear. There's the fear of bad news. No one wants bad news, right? No one wants to hear that something's going on with their cholesterol or their heart. But again, it's about getting ahead of things, right? If you know in advance, you can take the steps, whether it be diet, whether it be exercise, supplementation, whatever it is, to help yourself out in the future. So it's about being more forward thinking versus it's being proactive versus reactive with our health.
Most women go in for like a well woman exam. Like I know I go every single year.
Like a yearly.
Yeah. So should men go in every single year as well?
At least, at a minimum,
oh, wow,
right?
Okay.
Because things change, right? You know, your diet changes, your stress levels change, right? So at least knowing where your markers are and to be able to track that, because it's about trends, right? So if I can see my inflammation going up, I can take action, right? If you're just not going every 2-3 years, now it goes back to, wow, now you're reacting again. So now you're trying to catch up to something you could have prevented. So we try to say at a minimum of a year, but I would say at least twice a year if you're healthy.
You got 5 tests here for men that you suggest they look at. One of them is testosterone. How important is that?
Extremely, right? Because we think testosterone, we always think muscle building, right? It's like, it's the bodybuilder hormone, right? But testosterone does so much more than that, right? It's actually protecting your heart, it's protecting your bones, it's helping with brain function, it's actually lowering inflammation, keeping muscle, right? So the thing about it, as you get older and we lose muscle, because we're all going to do that, that affects your overall health, right? That's a big part of it, right? With CRP and ESR, these are inflammation markers. Now, inflammation is probably one of the most dangerous things out there because inflammation can affect, you think inflammation and pain. Inflammation affects your brain function, your gut health, your aging rates, all these things. Vitamin D, we think vitamin D, immune system function, but again, vitamin D is going to help with inflammation and bone health and hormones, right? And then the big two, most doctors are going to check your cholesterol and HbA1c. That's about preventing and recognizing diabetes and also high cholesterol and cardiovascular health, right? So there's so many more labs, but at a bare minimum, you want to make sure you're getting those looked at.
And finding a doctor really that that you can have a good conversation with, right? You can ask them the hard questions. You know, I'm feeling this, and I'm feeling this, and feeling tired, and then being able to have those uncomfortable conversations, I guess.
Yeah, and you know, really it's about being transparent, because again, as guys, we have this whole thing, like it's the macho thing, I don't want to say something's wrong, but the more information you give your provider, the more they can help you. So it's okay to say you're tired. It's okay to say, I can't remember where my keys are half the mornings, right? Or I'm feeling sluggish. Like, these are important. Or I can't lift as much weights. I'm feeling weaker. They need to know that. So this is about getting ahead of things again.
General practitioner, if I wanted to go see a doctor, who would you suggest doing all these things? Is this a general doctor? Yeah.
Oh, besides me?
Yeah. So you have appointments available?
Yeah, you're taking your patients.
Therein lies the problem. But no, of course, with your general practitioner is a great start if you're going through the insurance model. Now, me as a naturopathic doctor, our model is a little different, so most of us don't take insurance, but this allows us to spend more time with our patients, right? And so that's always a great start. And then with the GP, if you go that route, they will, as endocrinologists, they'll kind of refer you to those specialists if need be. But I think what I like about our profession is that we kind of look at the whole person and not just the pharmaceutical side of it. It's like, it's more than labs, right? It's labs, it's how you're feeling, it's
what
history.
You're eating.
Exactly.
Your exercise, like you mentioned.
Great meeting you, Doctor. Thank you so much for coming in.
Dr. Jones, good to see you.
Thank you.
How do people get a hold of you? How can they find you?
So I'm at innovativewellness.com. That's spelled with an E-N, so not the traditional spelling. We're on Instagram under Innovative Wellness, Facebook, the whole... We're everywhere. We try to be ubiquitous, if you will.
Your thought process, treating the whole person. I like that. And we'll be right back.